Hi there, and thank you for joining us. I am Tom Hart, Director of Outreach for Critical Path Institute's Rare and Orphan Diseases Program. And I am joined today by our Executive Director for the program, Terina Martinez. Hi, Terina.
Hey, Tom. Great to be with you today.
Thank you. To begin, a little about CPATH. CPATH is a nonprofit that generates solutions to facilitate scientific and regulatory pathways that accelerate the development of therapies for people with unmet medical needs. And it has grown its own program, HD Risk, that focuses on advancing treatments in Huntington's disease. Today, on Huntington's Disease Awareness Day, we have a couple of special guests from Help4HD International with us. I'm pleased to introduce Katie Jackson, President and CEO of Help4HD, and Lauren Holder, Help4HD's radio producer and host, who will discuss the latest priorities, topics, and lessons learned in Huntington's disease treatments and developments. Hi, Katie. Hi, Lauren.
Hi, thank you for having us.
Yes, thank you so much.
We're so glad you're here. Lauren, Katie, why don't we kick things off by you're telling us a little bit about the great work you're doing with Help4HD. Katie, maybe you want to start.
Yeah, so I am Katie Jackson, president of Help4HD. We are a grassroots nonprofit organization that actually started a podcast back in 2010 and have grown from there. As of right now, we're running 12 programs and projects at Help4HD International, supporting the Huntington's and juvenile Huntington's disease community. Some of the work we do everything from law enforcement education. We have a TV show, we have a radio show, we have publications. We are actually right in the middle of HD Awareness Month, which has been really fun, bringing awareness to the public across the nation about Huntington's disease. We have a relief fund, we have support groups that we run every week. We have a really cool database that we just launched for resources. We run an annual symposium. We have blogs. We have a really cool website with information and support services. So, and then we also do some stuff as far as we just did a patient listening session with the FDA for juvenile Huntington's. We played a big part in 2015 for the first patient drug development meeting, patient drug focus meeting. And that was really fun to be a part of that first experience going to Silver Springs. And we actually really were excited to find your docket. We've done a lot of stuff with that. And we also run surveys. We just finished a risk and benefit survey at Help4HD, talking to families about what risks they would take for benefits. So we kind of cross over in a lot of different places.
Awesome. And Lauren, I know we've talked before because I participated in a podcast, but tell me a little bit about the scope of those podcasts and their reach. That's been pretty exciting to learn about.
Yeah, absolutely. So I'm Lauren Holder. And it's so funny. I'm listening to Katie and thinking, God, we met at that meeting in 2015 at the FDA meeting. And I remember just hearing her speak, and I went, gosh, she's such a powerhouse. And now I do the podcast. I produce and host the Help4HD live podcast through Help4HD, and it's amazing. We have all kinds of episodes. We have an HD Uncut series that we do for the community to come on and share whatever it is that they want to share. We've had people who are symptomatic come on, share poetry. Those who are prodromal or don't have movements but have cognitive symptoms and behavioral symptoms come on and share their frustrations. We have resource podcast episodes of resources that are not just HD related, but could also be just part of rare disease. We have a Young Investigator series focused on research and all the new research that is coming out. We've done an HD Mythbusters series. We kind of hit on everything. So yeah, it's a lot of fun. Great way to get information. And I think that's one of the best things about it is you can always go to Spotify, iHeart, iTunes, and see any of those episodes all the way back to 2010. They're right there.
And I have a fun fact real quick that's really cool. So in 2010, when we started the radio show, our very first guest was Lauren Holder. How interesting is that? Yeah. So we started it and now we have over, 600 episodes available. It's like the HD library, but our very first guest was Lauren Holder, and she was talking about advocacy. And now here she is And I think when we did your award last year, Lauren, I think you produced like almost, 285 shows at this point.
Oh my God.
Yeah.
I'm getting chills with the synergy, how everything's just kind of coming together. Here we are on HD Awareness Day, and these interconnections and cross-pollinations. It's really, I think days like today and HD Awareness Month provide that opportunity to look, be thoughtful in reflection, and then aggressive and forward-looking. And this is, kind of what we're talking about here, looking at where we've come from and how we can go forward together.
So Katie, I want to follow up because one of the things I think is interesting is that Help4HD is international. And I was just wondering if you could talk a little bit about sort of that decision to be really a global connector, and what that means to the community, and maybe some examples of how that works in your advocacy.
Sure. So we're recognized as a national organization, but we have an international reach. And so how that started was because we started as a podcast, sitting around a kitchen table, we found, and when we shot it across the social media networks, we found that people were watching our show in, Europe and Canada and Pakistan and India. I mean, they were from everywhere, places that we didn't even really know there was a big HD prevalence. We had people tuning in and listening because we were able to see it on our back end of our podcast platform. And we actually started to have people. We had a lady I'm never going to forget from Pakistan that walked every day to a coffee shop, or every week to a coffee shop, to listen to the podcast, just to find out information about HD, because she had nothing in her area. So that's really where we decided we were really actually more of an international company. We were reaching internationally the HD community. And then when we really started pushing our social networks, and bringing the international voice, it was really interesting how Help4HD kind of became that platform where people were all kind of coming from all over the world. So we've been able to learn a lot through that, the different needs across globally.
That's fantastic. So my next question is really for both of you. So feel free, you guys can jump in, whoever wants to start. I just want to know a little bit about your backgrounds before Help4HD, and how it led you to this work. And I know you're both personal and full-time advocates. So this is your chance for a good elevator speech, and I'd love to hear some more.
Go ahead, Lauren, I'll let you start.
Oh gosh. Okay. So how did I start before Help4HD? I actually started my fundraising and everything started when I was 20, right after I tested positive for Huntington's disease. I found some people in my local community. At the time I was in Connecticut and away from my family. My husband was in the Navy, and I just remember going, I want to do something. And there was this wonderful lady named Sue Began who she wanted to do something too. And so we decided we were going to start a walk, and we did. We planned a walk in 6 weeks, raised $6,000, and had a casino sponsor the event, and everything kind of went from there. I would then, on top of fundraising, anytime I saw a need in the community, I ended up just kind of going that way. So law enforcement was a big issue because of my dad being symptomatic, and he got lost. And when I contacted law enforcement down where he lived, they wouldn't help me. So I got mad and decided to do law enforcement education in my area to make sure it didn't happen where I was. I was North Carolina chapter president, started a board, and did that for several years, and was also part of the National Field Committee, and was also a research ambassador at that time. So I was traveling around talking to others, talking to medical students and all kinds of stuff. And really it was 2015 when my dad got sick and my life stopped. I became a full-time caregiver for my dad, who passed away in January of 2021 with HD. But Katie and Katrina came to me, and when I was really at my lowest as a caregiver, and struggling with coping because I had cut everything off to take care of my dad, and they asked me if I would want to do the podcast. And basically saved my life. It has been my way of coping, and I am so very grateful for Help4HD being there and for bringing me in and giving me the opportunity.
Wow, that's amazing.
We could not have chose a better person too. I was like, when she said yes, we were like, yes, she's perfect. Yeah. So my journey, my childhood best friend since I was 6 years old, that I ended up marrying and having 3 beautiful children with, was diagnosed positive for Huntington's disease. And we didn't have any background of HD. I'm from a cystic fibrosis family. My brother has CF, and so I kind of knew how to be an advocate. I've been an advocate my whole life, but I never thought that I would go this far. My husband, when he found out he was at risk, we got a call from a mortuary that his biological father had passed, and they told us it was from something called Huntington's disease. And when I started looking into it, I was just shocked. One, what my husband may have to go through, and then what my children had a 50% chance of going through. And I think the most shocking thing was that I was looking for therapies or treatments or something to help my husband. I was in, like I said, the CF space. So I saw, Pulmazine come, and I found all these life-changing treatments for my brother that we were told he would die at 15. He's in his 30s. And I felt like there had to be something, and I dug and there was nothing. And I felt like I knew the power of advocacy because I had walked it and watched it in the CF space. And I really wanted to be a part of the change in HD. And I thought advocacy is the way to do this, right? I knew it was. And so I knew the power of the patient voice and the patient experience and how it could move drug development forward and how we could play a part in it because I watched it in other communities. So I really wanted to be a part of that change for my husband in the very beginning. So we started talking to government agencies and regulatory agencies right from the very beginning. Unfortunately, we saw nothing for my husband, and my husband passed away with no therapies, no treatments that worked for him. And it took away all his quality of life. And I'm going to continue to fight that does not happen for my children and my thousands of friends across the world. And that's really what really pushed my advocacy movement in the beginning, was that I couldn't believe that my new community had no options. And so if I stood back and did nothing, what was that going to do? So that's when I decided to kind of start using the little voice I had, because I didn't know much about HD at the time.
That's incredible. And honestly, one, thank you both for what you're doing. It's so important. But also on today of all days, to be able to sort of share these stories and remember them and stay grounded and the work that's been done and the thing that drives us forward. It is super important. And, one of the things that CPATH has really benefited from is this connection to advocates and community. We have this very unique role in the drug development process, but sometimes you can get in your silo with your researchers at your lab bench doing your work. But having that connection and remembering why it is that you work so hard, it makes a big difference. And the scientific process is refined and improved because we have people with lived experience, people who are living with the disease and their families, who can participate in it and help to identify those priorities and provide additional insight and context and motivation to the process. So thank you for staying connected and participating in the work of CPATH. It means a lot. I see Terina nodding. I don't know feel free if you want to jump in.
Yeah,
Now
so
we'll go on to our next question.
just to build on what you were just saying there, Tom, it is so important, when I have our meetings, which, convene the drug developers and clinician researchers and academic scientists and nonprofit research organizations, we do have a common goal. We all want to improve therapies and lives of people affected by Huntington's disease, but there's no better person to tell us what we should be focusing on, or we know there's urgency, but really, one thing that really resonated with me, Katie, you mentioned that some of the surveys that you guys were doing on risk benefit. we need this. This is an evolving space. This is something that we need to check in on. And there's no better person to share that perspective than you and the community you're engaged intimately with, because we want to bring that into our priorities and ecosystem, so that the work that we do moving forward to make drug development tools and innovate clinical trial design and improve outcome measures in the earlier stages of the disease. Because right now, all of the measures and clinical endpoints that have been used in trials up to this point are in further advanced individuals, and we don't need to leave anyone behind. We need to, find progress for everybody across the spectrum of the disease. But we really do need to build that toolbox in the early stages, now that the technology and the biology and the science has given us some hope, like you were mentioning, Katie, that other disease areas like cystic fibrosis have seen. We're really building that out. And so asking someone who has a better perspective, because they're thinking it daily about, what are their concerns, what they're willing to, tolerate, is really key and deeply appreciated.
Here on all of that, Terina. I just, as somebody who, I am in that, I have neurocognitive disorder related to HD. I could not agree more. And it's something that I have been talking to all of the stakeholders in HD about, and it's so great to hear that we are at a point now of being on the same page on things like this and moving things forward. So thank you guys so much for getting us there, right? And for helping us be at this point.
Yeah, and
Absolutely.
Lauren and I have talked about how it is, there's so much that, like the risk and benefit, just like doesn't seem like there's so many gaps in information, and for us to be able to play that small role in asking our community and the community like that we talk to every single day, right, through social media and everywhere, and asking them like, what are you willing, what risks are you willing to take? And the one thing that's been really interesting through these is, if you know one person with HD, one person with HD, everyone's very different. So it does kind of make it, but the one thing that we found across the board through these surveys is they are willing to take quite a bit of risk for little benefit, because they just want a chance. And
we don't have it. Yeah, we don't have it right now. We have, our reality is death. And so, yeah, I mean, we are willing to take risks probably that other people wouldn't consider, but it's because our other option's death.
Right. And even like, and Lauren, and not even just for you, what we find is for your children. Most people are willing to take so much risk, mostly for their children, because we are a family generational disease. So you see people standing up and being stronger, because you can be stronger for your children more than anything, right? Or your next generations to come. So the risk our community is willing to take is very high.
Especially because a lot of those children are young caregivers. They end up being young caregivers. And so it's so important on so many levels.
Yeah.
That's really an excellent point. And it kind of makes me wonder about what Help4HD is working on right now, and sort of what are your priorities, what's coming up for 2024. Maybe next year on HD Awareness Day, we'll do this and we'll have a whole lot more to report out and share with people.
Yeah, absolutely. Right now, we're very much focused on education. Our education events have seemed to be our big focus. So we actually, of course, we have our education through the radio show and the TV show, but then our live events, we actually just got back from Houston, and we're going to be in Chicago, and we're going to Washington, DC, which is really exciting, in October. So I think that I think one of our big goals is, now we have all this data, and we are a small grassroots company, but I think we're going to try to take some of it and get some white papers done. I think that's a big goal of ours. That way it's not just floating in space, and everyone has a place to actually go to the website and find these white papers from what we found. So I think we're working a lot on that. Another thing we've just hired one full-time and one part-time social worker, and we're really trying to make our response time to the families in need faster. And especially because a lot of times it is a crisis situation. And so we don't want to let it go as far as with that wait time is sometimes crucial. So we're trying to cut that down. I think that's one of our big goals. And of course, we're really excited. We just found out we get another meeting with the FDA, which HDSA let us all know. So that's super exciting coming forward. And the more talk we get with the FDA, the better. So we're excited. We're very excited about that. But I think as Help4HD, our goal is to still keep pushing forward and bringing that day-to-day support that's so desperately needed. We hope and we push forward for therapies and treatments in the future, but these people are living with financial, emotional, and physical devastation every day. So we play a role of boots on the ground, really helping them with that.
Can you tell me a little bit about what that support for people and families looks like? If I had a family member and learned that they had HD, how could I learn about it? How could I get support from Help4HD?
Yeah, so I think our newest program is really, really interesting to talk about. Our new database we just launched. You can find it on www.
One of my favorite programs, I'm just telling you.
Yeah,
Sorry about that.
No, thank you for that. Yeah, no, I'm so glad people are utilizing it. It's actually a huge resource database. It's AI driven, human vetted. You can go on, you'll see a banner on the top of our page that'll push you into the resource database. It's very overwhelming. There's thousands and thousands of resources, but you can actually tap in your area you live, and it'll hone in the resources for you within your area. There's also a contact us button that you can contact us, and that'll give you direct support to our social workers, and they can do case management through that. We also do provide, we're the only company that actually has a relief fund. So we do help with electric bills and things like that. We also, our social workers work on trying to have a more like pay one and done, because we know that the financial hardship will continue. So we also try to save someone from losing their electricity, right? But then also our social workers helping with different programs and stuff that could help that it doesn't happen in the future. We do a huge Christmas program every year. We send hundreds and hundreds of families Christmas meals, holiday meals in November and December. And we do that as well as our standard. We also have our genetics testing fund. So
my favorite one.
Yep, you can go through HD Genetics at-home testing. And if you can't afford your testing, Help4HD has a financial assistance program that can help you do your genetics testing process.
Wow, that's incredible. I'm so glad that there are resources for families, and it's, I think, an interesting component of the disease that there's this familial role that's played. Right, it changes sort of the way that the advocacy works. When you're out talking to lawmakers or legislators, this is different, right? This is generation after generation struggling with something, and being able to understand and study the genetics of it is really a more modern phenomenon, right?
And to go to your point on that, is because of generation after generation, it's also generational trauma, right? You have a different perspective with caregiving. If you are gene positive versus or at risk versus somebody who's not, and there is a trauma response, a type of PTSD response to that, as well as generational trauma of living in a family when you don't have resources. Right? If you don't have resources, people suffer and things fall through the cracks. And so that is absolutely there too. Again, just goes back to that point of why we need to move things forward faster, because these things will continue until we have something.
And Lauren, what you brought up, you just made me think, thank you so much for bringing that up, because we were just doing this grief and guilt talk. And when you look up grief, it says grief happens on day of diagnosis. That is not true in the HD community. Grief happens usually from when you're a child and you realize your grandmother has Huntington's, and now your mom and dad could have Huntington's, then you could have HD, and you deal with anticipatory grief in HD your whole life from when you were a child.
Yes.
So it's the grief that our loved ones have to endure from childhood is just, so that's what the genetic testing thing, people will say, you know, are you sure that you want to get genetic these people, this individual has thought about testing probably since they were 10. They have thought about testing for years. For 8 years, they weren't able to, right? Because they're not an adult. And then from 8 on, now they can, and they're going back and forth daily about testing. So I always find that when it's been in their life, their whole life, right? And it doesn't, you know, like us, we found out HD out of nowhere, but most people, when it's lived your whole life, I'm like, people have thought about testing forever. Like, just to ask, well, how long have you been thinking about it? Like, it's
No,
crazy.
but that's a great point. And it's actually something that I was traveling to Boston past couple days. I was invited to go speak to a pharmaceutical company. And that is one of the things that I mentioned, Katie, is the fact that the grief is not, it doesn't end. It is a constant thing in your life that is always there because you know what your future holds. And as of right now, with nothing for us, it's even worse. So yeah, I mean, such a great point.
One thing that's really resonated with me, well, so much of what both of you were saying has resonated deeply with me, but wearing my scientist hat, or I guess maybe scientist lab coat is a better analogy there. The importance of genetic testing, obviously, it's very, very helpful to understand that perspective of, you know, the families living through it. But for a long time, I'm sure it was something, you know, as those individuals thought about genetic testing, there was an unsatisfactory element of, well, in terms of knowing knowledge is power. That is absolutely, you know, true. But did it change the outlook for therapies and interventions? And we're not at the finish line yet, but with the information of the prevalence and the population that is getting primed for the opportunity to, you know, try to intervene earlier, use a gene therapy to prevent, you know, the researchers and the drug developers need that genetic information. So we're now, I think, reaching a point where we can meet in the middle with that very complex question of the genetic testing and what does it mean, because it's major ramifications on all sides.
Absolutely. Absolutely. And I think we've always said, you know, a lot of times people say, well, why would you test for HD? There's nothing you can do. There is stuff you can do. There is power in being in a clinical trial. There is, you know, gives you some control in a completely control helpless situation of HD. You get to be a part of the change. Lifestyles can change. There's so much there. So I think that we need to change that narrative too. Of that there's nothing you can do, because there is stuff that you can do.
Well, right. So Katie, yeah, again, just, you're so right. And it's been this narrative for so long. You know, when I was 20, that is what I was told. This is a death sentence. There's no reason for you to test. I'm 38 years old. And that narrative of a death sentence continues, but it doesn't have to. And we have to change the narrative. We have to change it from dying from HD to living with HD. And that time is now, because there are things we can do now. And so it's such a great point.
It is really fascinating. And I don't want to put you on the spot, Terina, but this is sort of where you begin to ask about what HD Risk is working on, where those priorities are, and how groups and individuals like Help4HD and Lauren and Katie can participate or learn more about that work, and where there are chances to plug in and participate.
Yeah, absolutely. So the HD Risk is our acronym for the Huntington's Disease Regulatory Science Consortium. This is a public-private partnership and consortium at the Critical Path Institute focused on Huntington's disease, with the mandate of bringing solutions and drug development tools to improve therapeutics and advance therapeutic intervention in Huntington's disease. Our current focus is really trying to fill the toolbox of more sensitive measures and of assessments that can be used in earlier stages of Huntington's disease, so that drug developers don't have an impossible puzzle in front of them by needing to enroll large trials for long durations using incomplete measures that don't give a complete picture of what is going on within the heterogeneity and individual experience of the disease. Katie, you mentioned earlier, you meet one person with HD, you know one person with HD. That complexity comes into the clinical trials. So we're working with the full community to maximally leverage the data that we have and what we know from natural history studies. So these are studies that groups like CHDI have been working on for several years to understand the spectrum and trajectory of individuals as they progress over time in Huntington's disease, so that we can really begin to narrow our focus in certain areas and say, okay, if we're looking at this stage of the disease, what biomarkers, and biomarkers are something measured in the body that tells you what's happening in the disease. A great example of a biomarker is high blood pressure and the risk that it has for heart disease. So you can have an exercise plan and reduce your blood pressure, or you can take medicine and reduce your blood pressure, but you use that test of the blood pressure as the biomarker. We're trying to come up with analogous biomarkers and measurements for Huntington's disease so that we can build that toolbox to maximum effect, so that groups and the pharmaceutical and biotech companies trying to develop interventions for Huntington's disease can have a better chance of getting an effective and clear answer in their clinical trial without overburdening the community by asking them to participate in a long study that doesn't have a clear endpoint. So it keeps me awake at night. It's a lot, but it's so important. And what's so gratifying to me is that, groups like Help4HD and the clinicians who are, working so hard to help the patients they see every day and, and not meet another generation of the family they've been treating in the clinic. When everyone comes together with the same goal and urgency to bring the respective expertise and collective knowledge, it really does help us enhance it and move it forward. So that's what we're working on. We have some exciting inflection points coming up this year. Katie, you mentioned that later in the year there's going to be the patient listening session with the FDA within the consortium within HD Risk. We have a meeting, a research roundtable meeting coming up in the summer, so that we can engage several experts at the FDA and talk about these challenges and creative solutions for clinical trial optimization and therapeutic development. So this will be, a really important, milestone for us mid-year, which will then give us a lot more targets and focus for the rest of the year moving forward.
That's awesome.
Thank you, Terina. Okay,
so exciting. I just have to say that made me just really excited. So I was writing notes.
Don't worry, Lauren. Me too. And I guess this is a good opportunity to offer like a last summary, some key points. So much of the role of CPATH as convener means that we're bringing together the eyes and thoughts of regulators at FDA and other organizations around the globe, biotech and research organizations, and advocates. So as advocates, this is sort of a great platform to bring some of those highlights forward. So I just want to give a chance sort of open mic time. If there's anything you want to put forward, or priorities and highlights for the upcoming year, this is a great chance.
Katie, you go first.
Okay. I think that my big thing is that I really love how there's been like a change in the patient voice, and how important it is to empower the patient voice and experience and lived experience. And I love how different organizations, including regulatory organizations, are listening to that and understanding. And I hope that keeps evolving, really understanding the burden of the caregiver. How does this disease doesn't only impact the person living with HD, it impacts the whole family, the children at risk, the caregiver, and then we have so many subpopulations, right? So really listening to these different groups and understanding the true unmet need. I remember I was talking in a group and I mentioned hypersexuality, and someone looked at me and said, "Oh, HD, people with HD don't have hypersexuality." And I said, "Have you talked to a group of people with HD before?" It's really, and this was a decision maker. And that was really scary to me. that a decision maker didn't really understand the disease, some parts of the disease, right? So I think understanding just what, if you met one person with HD, you met one person with HD, let the community empower them to continue to tell their stories, and also know what works for one may not work for another. So we deserve a lot of options, and we're willing to put ourselves out there to get those options. So I think, just the partnership with science and care and advocacy and regulatory coming together to expedite this and get critical therapies to our community as fast as possible, because time is something we do not have.
100%. Time is not something that is on our side. And as a person who is faced with it, and I am 38 years old and I am living that, it is more evident than ever. Every day that passes, it is on my mind that I'm losing time. And so I am so incredibly excited about the fact that for the first time, I am seeing a collaboration on a level we've never seen, and to have a patient voice that we've never had. And it's incredible. And I can't thank you guys enough for being part of that. I'm spending my next days, my next 2024 days of 2024 speaking with the stakeholders, I've been talking to pharmaceutical companies. I've been in talks with Tom. I've been doing podcasts about Act for ALS and about advocacy, and started my own YouTube channel called Dying to Live, to be able to talk about that side of things and how I feel, and the things that other people are feeling that they're telling me, but they haven't necessarily been able to say it. And I think our time is now, right? Like, we are now at a point in our community that we feel like we can speak and somebody's going to listen. And that's very empowering. And we're going to see people who are willing to speak up, because we've been saying it. It's just so many people get tired of saying stuff and then nobody listens. And that's not the case any longer. And so, yeah, when it comes to that risk versus benefit, I think that's going to be one of the best things that we see is, realize that we are very much willing to take the risks. And, even things that you guys might see as, or FDA might see as, oh, well, that's too much. Not for us, because we're dying, and for me, it's no different than somebody who has a brain cancer. And they have options, and I want to have options, and I want to be able to make the choice. And I know others in the community feel the same way. And they're very much feeling that sense of urgency of, we're running out of time. So yeah, incredible time to be dealing with all of this. I'm so excited of what's to come for you guys, of what we are working on, behind the scenes, and just advocating and really trying to get people to understand how monumental this is, that we finally have this voice and we can speak. And we've got the meeting with the FDA coming up, and yeah, just super excited. So thank you guys so much.
Yeah. And Lauren, one thing that you said that made me think also is, we talk about risk, but let's talk about benefit, right? Like, when you have nothing, a little benefit means a lot. And I think that is so important for the FDA to understand, is we approve drugs that, for only in cancer, that help people live an extra 2 months, right? Or quality of life an extra 2 months. We deserve that too. And that benefit may not be as great as what you may think is a great benefit, but for us living it every single day, to us, that's a benefit. And that's a hope that our child can have that benefit. And hopefully that benefit continues to grow. We have to have a win here, and it may be a small win. And we understand that.
And we're okay with that.
We're okay with that. But at least give us a chance even to have a small win.
That's literally the conversation I had yesterday, was, even if you get me another 6 months, year, whatever, to get to the next thing that gives us a few more, I'll take it. Because as Katie said, that's a benefit to us, because we don't have anything.
Now, we deserve the big one, right? We deserve
we do, but we'll take the little one too.
Yes, exactly. We have to start somewhere.
Well,
I
thank
agree.
you
I mean,
both.
everyone wants the home run, but we can't let perfection be the enemy of progress. And so I think, that's the idea.
Absolutely. Absolutely.
Well, thank you both, Katie and Lauren, for joining us and joining the conversation. And I just want to say thank you. The first sort of little comfort that we can offer each other is knowing that you're not alone. And so one of the things that Help4HD does is it provides that support, that very, very basic support. So thank you so much. As we do the rest of this work, at least people with HD know that they're not alone, right? And that's some comfort as we begin this. So thank you. We will put contact information for Help4HD below. And for anyone interested in learning more about CPATH or Terina's work at HD Risk, you can visit our link site below. And again, thank you both for bringing attention to this and having this great conversation with us.
Thank you guys so
much
much.
for having us.